If you are on Medicare, or someone in your family is, this is one of those stories that could hit the wallet directly, but potentially in a good way. The Centers for Medicare and Medicaid Services is proposing a new rule for 2027 that would change how Medicare pays certain hospitals for outpatient prescription drugs bought through the 340B drug pricing program. Here is the plain English version. The 340B program allows certain hospitals, especially those serving lower-income and vulnerable patients, to buy some outpatient drugs at deep discounts. That part was supposed to help hospitals stretch limited resources and serve more patients. But CMS says there is a problem. In some cases, hospitals may buy a drug at a steep discount. Then Medicare pays the hospital far more than the hospital actually paid for that drug. And because many Medicare patients pay cost-sharing based on the Medicare payment amount, seniors can end up paying more too. That is the heart of the fight. CMS says its survey found major gaps between what 340B hospitals pay for certain drugs and what Medicare reimburses them. In some cases, CMS says the patient's share alone could be higher than the hospital's total cost for the drug. Under the proposed rule, CMS would pay for 340B acquired drugs at the drug's average sales price minus 33.4%, instead of the current average sales price plus 6%. CMS estimates that, in the first year, the change would reduce original Medicare drug payments by $4.55 billion. It also estimates Medicare beneficiaries would save $1.15 billion in drug costs. That is why this matters. This is not just a healthcare accounting fight. It is a senior pocketbook story. For older Americans on fixed incomes, medical bills are not abstract. A few $100s here, a copay there, a specialty drug bill at the wrong time. It adds up fast. The Trump administration is framing this as a fairness issue. If hospitals are getting deep drug discounts, CMS argues, those savings should be passed along to Medicare patients and taxpayers, not kept as a hidden spread inside the system. Hospitals are pushing back. The American Hospital Association says these cuts could reduce resources for hospitals, especially those serving rural, disabled, lower-income, or medically complex patients. Hospitals argue that 340B money helps support services communities depend on. So the real question is simple. Should Medicare keep paying hospitals far above what they paid for discounted drugs, or should that money go back to seniors and taxpayers? There is one more important detail. This proposal is budget neutral inside the outpatient payment system. CMS says lower drug payments would be offset by higher payments for non-drug outpatient services. So this is not just a simple spending cut. It is a fight over where Medicare dollars go, who benefits, and whether seniors see lower out-of-pocket costs. This rule is not final yet. CMS is taking comments, and hospitals, patient groups, drug makers, lawmakers, and lobbyists are all going to weigh in. But the political battle line is already clear. The Trump CMS says it is trying to stop hidden hospital drug markups and cut costs for Medicare patients. Hospitals say Washington is threatening care in vulnerable communities, and seniors are left with the question that matters most. Will this actually lower my medical bills? That is what to watch next. Watch for hospital lobbying, lawsuits, congressional pressure, and whether CMS keeps the rule intact before it takes effect in 2027. Because if this survives, it could become one of the more important Medicare wallet stories of the year. Follow us at the Federalist Papers on Facebook and Instagram.